So Donald Trump has started again with immigrants. You know, his administration doesn't like immigrants coming into the country, even though his grandparents are immigrants. He says right now, immigrants are taking a lot from the US economy. Their presence, majority of them, their presence is taking some serious toll on the US financially from the US government, and because of that, his administration has been making some serious rules to limit visa access, especially to persons from third world countries or people who may not have the financial means to foot their stay in the US. And this time around, he has gone after people with certain illnesses that they feel could cost a lot of money to treat or to manage. And what are those two illnesses? Diabetes and heart disease. So anybody with that illness has a very low chance of getting a US visa unless the person has the financial means to take care of themselves in the US. Then it says US to deny visa to people with diabetes, heart disease, or other chronic illnesses. Foreign nationals seeking to immigrate to the United States could now be denied visas and green cards based on pre-existing chronic health conditions such as diabetes and heart disease under new guidance issued by the Trump administration. The directive, which significantly expands the criteria for who is deemed a potential public charge, has been sent by the State Department to the US embassies and consular offices worldwide. A cable sent by the State Department to visa officers instructs them to flag applicants whose medical conditions could require hundreds of thousands of dollars worth of care. Hundreds of thousands of dollars worth of care. The list of conditions cited includes, but is not limited to, cardiovascular diseases, respiratory diseases, cancers, diabetes, metabolic diseases, neurological diseases, and mental health conditions. Diseases, illnesses that they feel will cost a lot of money to treat, to manage. They are not willing to give people who have these illnesses or who are predisposed to these illnesses visa into the country. The guidance also specifically advises officers to consider conditions like obesity, noting that it can lead to costly complications such as asthma, sleep apnea, and high blood pressure. All these chronic illnesses are now being assessed as potential indicators that an individual might become a future financial burden on the United States. The policy shift, revealed on Thursday, is one of the most aggressive moves in the administration's broader immigration crackdown, effectively linking an applicant's health status to their eligibility for entry. It was not immediately clear if the directive applies to tourists and student visas, while it technically applies to all visa applicants, including those seeking non-immigrant visas for tourism B1/B2 and studies F1. It is expected to be primarily used for those seeking to permanently reside in the US. So those who are trying to get a permanent stay in the US, that is their main target. If you are going there on a temporary basis, of course, they will not be very strict or deny you visa if you have this illness or illnesses. At the heart of the new guidance is a stricter interpretation of the public charge rule, a century-old immigration provision designed to exclude those likely to become primarily dependent on government assistance. While health screenings have always been part of the visa process, traditionally focusing on communicable diseases like tuberculosis, the new directive vastly expands the list of conditions to be considered. So before it was mainly tuberculosis that they were focusing on people with tuberculosis, but now they are expanding that list to people with certain kind of illnesses, which means they will still add more to this list of illnesses that I've just mentioned later on. Immigration advocates warn that the new rules grant consular officers who lack medical expertise sweeping authority to make subjective judgments about an applicant's long-term health, since no one is expected to disclose their ailments in visa applications. They have urged the visa officers to use their discretion and pass judgment on who they feel has this illness and who doesn't have it, because visa applicants are not required to disclose their health status. And of course, visa applicants, knowing that they will most likely be denied visa if they have this health condition, they will not include it in the application. Even if they are demanded to, they want to hide it. So they are telling their visa officers to shine their eyes very well and look out for who may have this illness. And even though these visa officials are not health experts, they are just telling them to do guesswork. So it just means at the end of the day, more persons to be denied visa for ridiculous reasons, to be denied US visa for some very ridiculous and minor and strange reasons that they can't even understand. Well, if you have been denied a US visa, I hope you are now having a clue as to why you may have been denied that visa, and for some reason that you cannot even understand. It's because the officers are being told to even use their own discretion. They are being told to limit the number of persons they give visas. Under the new framework, visa officers are explicitly instructed to determine whether applicants have the financial resources to cover the costs of such long-term medical care over his entire expected lifespan without seeking public cash assistance or long-term institutionalization at government expense. This is what I just said earlier on. The visa officers are also expected to use their discretion to check and find out if whoever is coming to the US has the financial capacity to foot his bills during his or her stay there without seeking for public cash assistance, without asking the public for help if they are having any health challenges. Immigration experts contend that this policy will dramatically reduce legal immigration for older applicants and those with common chronic illnesses. Effectively, the policy will favor the wealthiest and healthiest applicants. So, at the end of the day, those with money will still get into the US because, like I said, the US says immigrants are taking a lot from their country, so they are looking for people with money who can take care of themselves and even add to the economy rather than take from their dwindling resources. So, like somebody said, I think somebody said that the US is broke and they're just looking for money left, right, and center. And that is why they're making all this talk about invading Nigeria. They're just trying to come and see what they can get from Nigeria. That the US is broke, and I think this is proof. I think this is proof that the US is struggling financially. Still, for those who are always seeking, of course, to leave their country in search of greener pastures, that is the people they are targeting with this rule now. Because people who have money, who don't have any visa ban, they still go to the US and come back, whether they have this illness, any illness or not. Then there are still people from third world countries like Nigeria that their country is in bad shape and they're always looking to escape, that are going to feel the heat of this new rule. And let's hope it doesn't affect students as well, because students have been really affected with all these strict rules on visas. A lot of persons who have full scholarship to study in the US have been denied that opportunity because they could not get visa, which doesn't used to be so until a couple of years ago. And with Trump now in power, it has gotten really worse for students who have full scholarship to study in the US.